This conference will now be recorded.
Hello, and welcome to a Healthcare Ready presentation on COVID-19 and the impact of this outbreak on communities of color. So first, we'd like to just give a brief overview of some of the work we do, why we were founded, and our mission. So Healthcare Ready was founded in the wake of Hurricane Katrina, and it was a response to the identified need for more coordination between the healthcare supply chain across the board to ensure that patients can continue to access their medication in times of crisis and continue to interact with the healthcare system as needed to protect public health in times of crises. So some of the lessons learned, of course, we were created in response to these lessons learned and the call to action, formerly known as RX Response, but over the years have developed into not just resources for prescription medications, but really a broad look at the healthcare system and the healthcare supply chain, and serve as a linkage between public health, emergency management, the public sector, the private sector, and all of the channels that people coordinate in response to crises to protect the health of the average citizen. And through this work, of course, one of the things we see time and time again, and one of the reasons why equity and the attention to diverse communities and marginalized communities and those most vulnerable is that disasters don't necessarily bring about new inequities and create new challenges for different communities, but what they really do is expose the challenges that already exist. And so we really see oftentimes in times of public health crisis, the health disparities that already existed prior to the crisis hitting are really just exposed and they're exacerbated. So different health outcomes from disasters happen as a result of the different health situations that we already see in these communities. And in a time of an infectious disease outbreak, we see exposure rates are different for different communities. Different people, depending on their work status and the type of work they do, have different exposure to infectious diseases and a different capacity to really protect their health. And so that's why it's really important as emergency managers that we not just look at how to protect infrastructure broadly, but how infrastructure and how different communities interact with this infrastructure differently and have different needs that need to be addressed and responded to. We see medical fragility increase as we see people with chronic conditions who have to access healthcare more often than others, who do have a heavier need for medication, treatment, or just regular, interfacing with their healthcare providers, their pharmacists, their doctors. We see that this fragility in a time of crisis where systems may be disrupted is going to disproportionately impact those that rely on those systems on a day-to-day basis versus those that may just be getting a regular, yearly checkup. Misinformation, fear, and uncertainty are other really important facets of how resilient a community is against disaster, and again, something that is necessarily, not necessarily just created by a disaster, but really exposed by it. So the spread of misinformation, rumors, and really dangerous hoaxes and just lies about how people can protect themselves in a time of crisis can be really dangerous to those that do not have as many levels of access to the correct information and to the stakeholders in their community that are really trying to get information out there, leading to high levels of fear and uncertainty. And of course, this has impacts on people's health, of course, fear and uncertainty leading to higher rates of anxiety, impacting their mental health and people's ability to really recover from physical health impacts as well. And why this conversation is critically important now, always important, but right now in COVID, we are seeing extreme disparities. We see right here, this is just one of the many studies that is out there really highlighting the disproportionate impacts that we've seen. We see here that on average, the data we have at, this date being May 26th, about 30 or so people per 100,000 people has died of COVID. And that number almost doubles when you look at the comparison between the general population and Black people. And so it's something that cannot be ignored, and not just by shedding a light on the impacts, but really looking at these incredible disparities as a call to action for emergency managers, for the community leaders that support in communities of color, as well as the public health leaders that are intended to support public health of all citizens. And this data is only just beginning to come out. We have this data source, for example, collected data from about 40 states, including DC, and there's still insufficient data coming from states reporting indigenous populations outcomes as well. So on this graph, for example, you don't even have those numbers. And so that's something that is an ongoing issue, is getting more data so we can really understand the disproportionate impacts. And this highlights the level of data that this source in specificity was working from. We have about 39 states that are reporting data on the racial mortality data. And this is only a spotlight of the COVID situation. So it's really incredibly important for public health sources to really be releasing this information. And so the next step, when we have this information, when we have a data that paints the picture that Black and Brown people are dying at higher rates, we have to look at the why in order to understand how to respond. And so two of the pillars of how Healthcare Ready has been looking at this is looking at the higher rates of chronic health conditions and higher rates of environmental exposure. And this is important because Healthcare Ready already looks at chronic health conditions as a vulnerability in times of crisis. We, as supporters of the healthcare system and supporters of public health and healthcare in times of crisis, recognize that having a health condition that, again, we're reiterating the point that if you have to interact with the healthcare system more often, that makes disruptions to the healthcare system more impactful to your health. And so chronic health conditions are just a tenet that we're always looking at. And during an infectious disease outbreak, environmental exposure becomes incredibly important because it's not it's not a hurricane or tornado where once the disaster hits, now we're just in a response mode. It's an active response to prevent further exposure and to prevent further crisis. And it really is it's a life or death matter in the time of COVID. So these three conditions are highlighted as they are consistently reported by the CDC as high risk conditions for severe health outcomes from COVID. So really, exposure is one thing as we're looking at how likely someone is to get COVID, but once someone is COVID positive, these are some of the conditions that make it harder for someone to recover. These are some of the conditions that may weaken an immune system and weaken the overall response and the ability of our bodies to really recover from this infectious disease that we're still learning about and still understanding its impacts, but we know that these underlying conditions can make it so much worse. And that's really important to understand when we look at the impact on communities of color, because we see how, especially in Black communities highlighted with some of the research that we've done, really we have such higher rates in the Black community. And so if we're looking at how to protect citizens from a crisis that is impacting their health, we have to look at those who have the toughest challenges and the greatest impediments to healthy recovery. And then we look at environmental exposure, of course, in the time of an infectious disease outbreak. One of the things that's really interesting and incredibly important to understand is the multi-generational households and the fact that Black and Latinx populations are more likely to live in communities or in households where there are several generations of adults. And this is important because we know that COVID has a much greater severe risk to elderly people above 65 years of age. We know are at a much greater risk of death from COVID, about 8 to 10, they are 8 times more likely to die of COVID if you were 65 years or older. And that's really important to think about if we have households where people are more likely to be spreading COVID to elderly people, as they are not socially distanced from elderly populations. So if we look at communities where there are higher rates of people living with elderly, it's important to understand why that might be a risk factor. And then healthcare access, of course, is really important. Something we think about all the time, as we know that disruptions to healthcare are a expected outcome of a disaster. But when you already do have reduced access, when you already live in communities where the healthcare system may not be as well resourced as white counterparts, then we're working in a situation where people are less likely to be able to really focus on their health and really protect their health from a crisis because the resources are just not there. And especially, when it comes to health insurance and the discouragement that someone may feel to really focusing on their health, if they simply cannot afford it, if they simply do not have the health insurance at the same level as white counterparts. And so environmental exposure, and these are just two areas that we highlighted here. But we also know that we're looking at the higher rates of exposure within communities of color who are essential workers, and the fact that Black and Brown people are less likely to be able to work from home and truly practice social distancing. And so that creates a heightened level of exposure to COVID. If you are working in a store, if you are working as a healthcare facility, if you are working in public transportation, if you're not able to stay home, and those are just examples, if you're not able to stay home, that of course increases your likeliness of catching COVID and of course having a higher risk of a severe impact. So environmental exposure is incredibly important to look at. And all of this information really just paints the picture that community resilience is something that has to be equitable, and it really has to look at how different communities are set up differently. Different people within communities have different levels of access to the same resources, and really looking at the barriers and understanding that it's not necessarily an issue of choice, an issue of negligence on the individual level, but really the community has to be built to be stronger and to be resilient to protect the individuals at the greatest risk for severe impacts in times of crisis. So we can paint a little picture of some of the work that Healthcare Ready has been doing in the COVID response and how we have been trying to support patients and communities of color to recover from COVID and protect their health amid COVID. So broadly, Healthcare Ready works with a range of stakeholders that spans the federal government and federal emergency managers and federal public health agencies, but all the way down to local level organizations, community groups, patient-based groups, and coalitions of community leaders that are really supporting the most marginalized and the most vulnerable in times of crisis. And this expands, a range of activities, but we've highlighted some of the areas that we focus on broadly. And you'll see these graphics also kind of paint a little bit of picture of the broad stakeholder engagement network that we're looking at, and the number of groups that we engage, whether it be sending out resources, having phone calls, sharing information, partnering and creating new coalitions to respond to specific issues, coordinating donations, coordinating supplies. One of the incredibly important parts of our COVID response has been, of course, coordinating the donation and the procurement of personal protective equipment from the level of emergency managers and coordinating large-scale donations to city and state level emergency management agencies, but all the way down to community organizations and community-based groups that are doing food distribution, for example, during COVID, and reaching out to get protective equipment so they can continue to fight against levels of food insecurity, the lack of healthy food during COVID. One of the ways that we try to support groups broadly is by making just a number of resources, tip sheets, FAQs, documents available to either explain some of the coordination work we're able to do and really get that information out there, or just break down some of the ways that people can protect their health during disasters. And this includes a number of things of preparing your home and your prescriptions, preparing food to make sure that's available to your family, your loved one, understanding your medical information, understanding and getting, keeping a list of the healthcare facilities in your area and how to contact them. We really break down key steps people can take to protect their health against all types of crises. And we have a number of tip sheets, but we've highlighted here, of course, the one of most relevance to COVID, our pandemics and disease outbreaks tip sheet. We also have partnered with organizations to create a FAQ on pharmacy care, and this is really angled at patients and pharmacists. Of course, again, we support patients, we support communities, we also support the healthcare system. And so this includes a lot of information and work to help break down some of the safety behaviors that pharmacists are taking to protect their clients and really inform them on the best strategies they can use to protect their business, to protect their supply, to protect their inventory, and continue to be available as community leaders and the people that those with chronic conditions really rely on. One of the most really incredible projects we've been working on and really fun projects that Healthcare Ready has taken on in the COVID response is trying to make the information that we create more accessible, because we can make all of these FAQs and fact sheets and tip sheets, and we know that there still needs to be a lot of work to really get information out there, really get people, looking at it and understanding the breakdown and just overall why it matters to protect their health during crisis and how Healthcare Ready can help. We have a video that really breaks down some of the risk factors for coronavirus, some of the conditions, diseases, and communities that may be at higher risk during COVID, and some of the steps people can take to protect their health. We also have overall videos on disaster preparedness and the ways that you can access your medication in times of crisis, and again, continuing to understand how to interface with the healthcare system when there are disruptions. And this brings us back to some of the critical things that we look at when we think about community resilience. And we recognize that there really is a chain reaction that impacts a person's ability and a member of a community's ability to recover from a disaster, and very particularly in the case of COVID, recover from a public health crisis. So we have here really walking you through the steps, and these are just snippets of infographics we've created. We put out a lot of information to help patients and help pharmacists, but it's also really incredibly important for us to just explain the work that we do and explain why it matters, and to really break down why emergency managers and public health officials should be thinking about community resilience in these ways and some of the ways that we analyze it, because we are also trying to educate our stakeholders and our partners on the best way to respond to crisis. We see here that income is a major factor in one's resilience against disaster. Essentially, if someone does not have the disposable income, cash on hand to prepare for a crisis, it can prevent their ability to seek out communities that are well-resourced, and may be more likely to seek out communities that have fewer resources, that are easier to live in and more affordable living. And that builds into the resilient infrastructure, because if you're not able to get into a community that has more resources, the infrastructure may not be there to truly support you in disaster. And if the information and infrastructure is not there, then the information is not there necessarily. And there may be a lack of sources in your community that are really spreading helpful and credible information. And that can lead to a lack of trust if you don't have a community where your leaders are well-resourced and are able to really reach out and provide the information that you need to protect yourself during a crisis. And this, of course, has an impact on people's health. So really the point of this graphic, and again, these are just breakout pieces of it. The point of this is to explain that a health outcome from a crisis is not necessarily a matter of personal choice, but really the systems that are in place to protect people and how they all feed into each other. So it's the job of emergency managers to look at emergency management as a through a lens of equity and have an equitable approach that recognizes the different levels of capacity in communities, and to resource those that need it the most. And we've been reiterating that we're working with a range of stakeholders, from faith leaders to specific patient groups that are supporting folks with certain conditions, to elected officials. Right here, we have highlighted some social media cards that we created, particularly to meet the needs earlier in the month of April, when there are so many religious celebrations. We were really trying to ensure that faith leaders had the resources and the information that they needed to continue to practice social distancing amid the holidays that we were celebrating. So these are just graphics we created to help spread some information that faith leaders could use to protect their congregants, and their faith communities amid COVID, and continue to operate virtually and practice social distancing. We've had a number of engagements, from listening sessions and micro summits, really again breaking down some of the ways that elected officials, public health policy leaders, emergency managers, community leaders can think about the impact of COVID on marginalized communities and the strategies that they can use to reduce the disproportionate impacts that we have seen. A incredibly important issue that we are also looking at, as emergency managers, we don't think about crises in isolation. We don't think about COVID as, the one thing that we're looking at. It's only one of many things. Of course, it's been incredibly important and a major component of the work that we're doing, but we're also looking at the crises that are impacting public health on a regular basis. And we know that communities of color are also impacted by racism and some of the unjust killings that we have seen of Black and Brown people. And the fact that in these communities, there isn't always the option to choose between protecting your health, and exercising your right to protest and your right to speak out against injustice. So what we've tried to do is create resources that actually allow people to, as best they can, do both, because we know many people just do not have the option. Because while COVID is a life or death matter, we know that racism is a public health crisis and often is a life or death matter as well. And so here we're trying to encourage people to wear masks, continually wear masks, even, speaking through a horn, continue to wear masks, bringing water, wipes, bandanas, having their medical information, having enough supplies to share if they're able to with fellow protesters. When they come back home from a protest, isolating and quarantining where possible, washing clothes and bathing thoroughly, the same way, essential workers have had to do the entire response, getting tested if it's available in their community, reaching out to healthcare providers about their exposure, and again, making sure that they are protecting their family and their loved ones as they're venturing out to protest. And so this brings us just to ways that people can continue to stay connected with Healthcare Ready. You can get more information about the work we're doing and how you can collaborate with us, partner with us, or how we can potentially provide a training on health protection measures amid COVID and preparedness for the next disasters, as we are in the midst of hurricane season as well. So you can visit healthcareready.org for more information, or reach out to alerts at healthcareready.org. Our hotline is available at 1-866-247-2694. And we have a site dedicated to COVID resources at healthcareready.org/COVID. And you can sign up for our situation reports that detail the work we're doing, the issues we're tracking, the healthcare infrastructure challenges that we're seeing. Our situation reports are released weekly during COVID, but more often during smaller disasters. And that can be, you can sign up for these at healthcareready.org/contact-us. And of course, we are on social media putting out these resources. So the social media cards that we highlighted are available on our Twitter and our Facebook, and we're on LinkedIn as well. So thank you for listening.